bam,
knock it out.
yeah.
Which is the reason why you want a specialist team. I can't preach that enough. I mean, you can find places where they have this full-on, we do everything. You know, I like to say they're like MacGyver. You know, they can do it all, but they're really not specialists or good at everything. And it always goes back to the medical model as well. So when you go to your primary physician, what really do you get done there? Not a lot. You can say hello and they can give you some prescription for something, but if you need something done, they send you out. You got a vision problem, go to the optometrist. You got a heart problem, cardiologist. There are specialists out there for that reason. And in dentistry, that's why, again, directing the thought process over into the specialty realm, that's where you should be looking, because again, if you're dealing with complications, you've got past medical ailments, or you've had complications with dental procedures even, and just haven't had the success that you deserve, that's the reason we exist, because of that. We minimize all that. There's so many decades of experience in this company. It makes a big difference in quality of care and overall experience.
Of patient testimonials and then their whole experience. But realistically, all of that compressed into one operating day or one day for procedures is mind-blowing. Even anybody who's had an operation, I mean, you kind of get the idea, right? You have to fill out your operation timetable. You have to get in touch, or beforehand, if you have some issues, your anesthesiologist will get in touch with you. Your surgeon will get in touch with you. And then on the day of, right, they give you so many directions to prepare for it, what you can eat. You probably basically can't eat, no fluid, none of that.
And in dentistry, just to interject right quick, that's something to actually remember as well. If you're dealing with sedation, sedation's massive. I'm not a believer in it, especially with implants. You really don't need that. It takes good skill to be able to anesthetize properly and to do it with very, very minimal pain, if at all. I mean, there's really ways to do it, to do the anesthetization without any discomfort. So if you're dealing with practices that are doing oral sedation, which is conscious, or you're doing IV sedation, then that's when it gets very intriguing, because you have to you have to not eat. You've got to have a driver. You're going to be unconscious. You're going to have to wait in the recovery room so many hours. I mean, it's so intense. It's really unnecessary in dentistry, I feel. Again, if you have major issues, which we actually specialize in folks with anxiety issues because of that reason. You've been through some trauma. That's why why we're here, because we know that stuff. A lot of us have already gone through dental pain over here, both of us, and other people in our companies as well, because of that reason. So we are very sympathetic to your desire, to your needs, and to the way you should be treated. So we make sure to minimize all that fear as much as possible. But just to remember that anything to deal with IV sedation or oral sedation in dentistry, it's very similar to the medical model. You've got to have the whole army of tasks that you have to do before, which increases your anxiety level to begin with. Just thinking about it.
It increases the risk too.
Yeah,
it increases the safety, the health hazards, the complications, the additional complications in addition to your existing complications. And the best way I explain this to anybody who hasn't ever done it, and they're like, I don't want to feel anything, I want to be knocked out. Right. It's like, how low can you get that engine to idle before you stall it out? That's the question. That is the question, right? Because once that engine stalls out, that's you, that's your heart, that's your brain activity, that's your being alive. How hard do you have to try to restart it, right? And it's a narcotic that gets you to that level where you are basically knocked out, but your body is still alive, right? So that's why you have specialists for this. You have an anesthesiologist that all they do is understand drug interaction, anatomy, human physiology, and then your weight, your height, your everything, right? And so this is why they do that, because it's no joke. So for elegant implants, we don't do general anesthesia. That's called general anesthesia, knocking you out. We don't, and it's for a very good reason. Matthew says it's not necessary, right? And it's very, very true, right? But also, it's just it's a huge load on your system. There's a huge prep, and then the recovery is, you'll have doctors tell you, we know exactly the effects, the recovery timeline, yes, it's degraded, and yes, it takes longer, but why would you want to do it unless you absolutely have to, right? And so we want to cause the least amount of pain, least amount of impedance to your life, while giving you the best care possible, right? So stalling you out or getting close to stalling you out isn't really my idea of, good living. So we don't do that, all right? And it's going to be up to our specialists as well. They're the ones who decide, what cases are good for implants, what cases, they can't take or it's too risky. That's completely up to them. That's why they are the specialists. They are the doctors that know how to do this day in and day out.
And that's the key, what you just said right there, is the team. That's another thing that really doesn't happen. So you go to a specialist. That's the key word there too. A specialist, it's one person. It's like a mechanic. You go to a mechanic shop to get your car work done. It's one guy's opinion. Does he know everything in the world? No. But he's going to give you the best thing he knows and make you believe that that's the only way to do it. In our case, or in Elegant Implant's case, it's that luxury of having multiple providers, multiple specialists across different gamuts, from oral surgeon, periodontist, periodontist, and prosthodontist. They all culminate. If there's something one person doesn't know, we've got the other doc and another doc and another doc. They can all figure this out. So you're getting beyond royal treatment to try to figure out what's best for you, which doesn't really exist in dentistry.
No, not yet, and that is really the hope, right? When you get all of these great minds together that have different areas of expertise and different patient bases and different experiences, you draw them all together, and they're colleagues. That's their support team. We are their support team. On top of that, like, we do all the stuff that that they don't need to do, and then they do all the stuff that we can't do, right? But you got that ninja. I call it the ninja team because I think that's what it really is.
Sure.
But when you have those high profile and just hard hitting colleagues, man, that stuff, it's like, that's truly the 2 + 2 = 10 situation. Right, and it's like Maggie said, you have one specialist, they might be really good for a certain segment, for a certain type of procedure, certain type of patient, but when you have multiple specialists together, that's superpower right there.
Sure.
So that's the benefit of it, and with Patient X specifically. So that's a good rundown. Let's see, what are we missing? Oh, and by the way, the PRP PRF, I'll have Dr. Ilya explain that. He is... Man, you guys have seen him a couple of times, a lot of good B-roll and whatnot, but he's got a lot to say, so I want him to share that with you guys specifically. He does a real great job explaining it and breaking it down. There's nothing like it. But we did cover that already. So the PRP, we covered some of the complications and then just difficulties. This was, by the way, this was full hands on deck situation. It's like 8 of us ready to at the ready to jump in when things don't go right, or when things do go right and then you need to follow it up. It was literally a well-oiled machine. It was beautiful. All right, it's beautiful. Let's see, what else for that one? Did I miss anything with the patient? The procedure?
The only other thing I can think of is post-op. So once we're finished at that day, it was more or less a list of instructions. Of course, when we're doing something that intense, we always like to have a family member or loved one around, or a friend, that can drive you and be there with you. So of course, we don't ever have anybody out of the element. So they're not under sedation or anything like that. So they're still able to comprehend and understand what we're talking about. But we had to go over the post-op part, which is no drinking through a straw and no spitting and things like that. Drugs after the fact, pain medications, antibiotics if necessary, and in this patient X's case, yes, that was needed. The person was even on antibiotics prior to that, so this was so intense that we didn't want any mishaps. So, and again, contradictions with pain medications is another issue. Make sure the right medications are prescribed, and then getting home and relaxing. That's really the biggest key right there. So whenever you're going through a procedure, you definitely want to make sure that the after part, you're going to be able to go home and relax. So if you got kids, we understand, it's not easy. Patient X had kids, so it's something to deal with. Just make sure this home is relaxed. Everything's set out for you. Nourish yourself, hydrate yourself, and it's very difficult to do. Again, it's almost like getting extractions. If you had a dental extraction, you're going to know it's not comfortable. It's going to be unpleasant to a point, just because of your healing, and that's the nature of it. If you're having an infected tooth extracted on top of implants, it's just like the trifecta. So there's a lot going on. It will take a little time to heal, but again, that's what we went through with Patient X. So just understanding that, after the fact, relax, basically. So, again, most people are going to want to do that anyways. You've been through the gamut for hours and hours and hours. You're going to probably want to go and relax. The nourishment part is also the other factor. So again, if you had diabetes, we always refer patients to drinking protein shakes. And I'll even tell them about Slim Fast. It's just not like a diet supplement only. So I even drink those things occasionally. If it's there, you need some nourishment, drink it. But again, you've got know your own health. Know what you can drink, know what you can't drink to that point to keep yourself healthy. And then just go from there. And we follow up also. We checked on patient X that night. We checked on patient X the next morning. We're very methodical and we're very caring of that business. Again, that's why we're here, because of that nature. So we made sure patient X was good to go. And again, still very successful. She's very happy with everything that we've done. So did that well.
Absolutely. And thanks for doing that. It's you can't even quantify that. It's that extra touch, it's that extra flavor, it's that extra edge that I call it the warm and fuzzies, right? And it exists in every sector, every industry. But I think it is particularly important if anybody's ever done surgery or had to have even outpatient procedures. Everybody knows when they're kind of getting treated like cattle.
Sure. And
nobody likes that. I mean, I don't care how used to it you are,
right,
or how many, what you've done overseas or whatnot. It just, it's human, right? To want to receive that care, to get that extra little bit of attention. And this is something that I'm really, really proud of, because it's not just, the staff, it's not just our participating providers, but our doctors too are the ones that check up on patients. They'll call them, they'll text them and whatnot, just to make sure it's like, hey, we care about you, we remember you, cool. Even though it's like, oh, well, patient check. Mm-hmm. That's still something that happens, right? So it's really, really important. And on that note as well, there's medical necessity that the doctors and the specialists decide that completely, but there's also something that is like the unwritten, which is as a general principle, we really don't like to over medicate. So unless you really, really, really need antibiotics, even if it's narrow spectrum, right? It's not wiping out all of your bacteria.
Sure.
It's still a really strong drug. Our doctors won't prescribe it. And that's a distinct benefit. I think the closer you get, like, got a lot of Canadian friends, they're really, really, they're adamant about it. It's like, oh, I'm not taking any meds. Similar thing here, right? People want to be healthy. They're really conscious of what goes into their body. So as standard practice, our specialists, if they don't have to prescribe you something, they won't. And that's a good thing. Have you seen the list of have you seen the list of, what do you call those? What am I thinking of? Not drug interactions, but...
contradictions, complications with other drugs?
The side effects. Yeah, side effects.
Right, there you go.
The side effects are just like a mile long.
Yeah.
For any garden variety drug, any one of them. I don't care which it is. If you look at that sleeve that it comes with it from the pharmacy.
Something's gonna happen.
Yeah, they literally list out everything, no matter, there's a scale, right? Like, over 1% of incidences, under 1%, whatever that is, I don't remember, right? But they do list it out, right, as a requirement by the FDA. It's horrendous. So as a general practice, that's not something that our specialists, and it's up to them, that they like to do. I think it's just one of those hidden nice things. It's the warm and fuzzies.
Correct.
You can't quite put your finger on it.
And even with the warm and fuzzy thought process, so aside from patient X, we've had patient, let's just say Y. Patient Y we took care of specifically on Sunday. We don't have a day of the week. Again, how many places are even open on a Friday, let alone a Saturday or a Sunday? Nobody works on Sunday, seriously.
10 days.
Elegant does. That's huge.
7
So
days.
it's Saturdays, Sundays, that's Elegant was there. They took care of everything, and that's what's important to remember. Again, we care. We're here to take care of these patients, give them the very best of care, and again, this is groundbreaking, I would say, because again, not many people care about it. In dentistry, what I've learned is it's a very lifestyle-based profession. So everybody, you guys all know this. You try to call your local doctor. You've been with them for generations, probably, and gone through the gamut. And then you call, hey, they're closed on Monday, so they're open, half a day on Tuesday. They're worse than banker hours. It's ridiculous. So, and now they're trying to find a specialist. Okay, maybe they're open 3 days a week, which is probably why it takes months and months and months to try to get in to see somebody, which is crazy. It should not happen that way. the providers are providers because they care about patients and they want to take care of the issue for you. But it goes back to lifestyle. They have a lifestyle that's enabled by the profession. So trying to find a practice is very difficult. In the Elegant's case, that doesn't exist. They are there all the time. So that's a beautiful blessing for anyone.
Unheard of. And I don't want to overstate this, but I really, really should.
No, for
right?
sure.
So we got a 24-hour call center.
Mm-hmm.
Somebody somewhere is available 7 days a week, and then many times that includes a specialist.
Right.
If you go right now to call a specialist, right? Call your dentist, whoever, and say, hey, I want an implant, right?
Mm-hmm.
Assuming all the legwork and all the boxes are checked, yes, you're healthy enough, yes, you got enough bone density, yes, you have your CT scans, yes, you have your X-rays done, and then you had your last comp within 6 months, comprehensive dental exam within 6 months, right? Those are bare bones requirements. Assuming all that, how long do you think it would take to actually book that implant? Like, how long do you guys think?
Mm-hmm.
Right? And then how long does it actually take?
Yeah, even what he just said, the bare bones part takes time. Normally you can't just go there and find a practice and that's what you're going to get. If you have an existing doctor, they're going to want to discuss things and take a look at the models, and everybody's got their own method. But in essence, it's not going to be fast. It's not quick. And if you're have an infection and it's all swollen up, again, 9 times out of 10, most providers are going to say, you're going to have to pull, we're going to have to wait, we got to antibiotic you, we got to do one thing at a time. If you're taking blood thinners, well, God, that just what we did, the first part of that procedure would have taken maybe a month, because we'll pull one tooth now, let you heal, maybe even more, just to get to that point. But again, it goes back to advanced principles, advanced theories, an advanced team that are dedicated, and Elegant, they're generational. These guys have been around for a long time, so that's how you have to think. When you're looking for a practice or you're looking for specialists, you got to remember what are these guys doing? Why are they there? And when you're trying to find a clinician, you've got to go back to like it's just general dentist. You've got to look back to, okay, what can they provide me? Are they available? I can relate it actually recently looking for a bank. Okay, so some banks like credit unions are only open, certain days a week, right? You need them typically, I find, on the weekend. Like, great, they're closed. I don't have any access to them. Now I got to wait till Monday. It's annoying. So that's something to remember. In dentistry, you got to find clinicians and practices and specialists that tailor to you. That's important. You shouldn't have to settle. So got to remember that.
Yeah, and typically, assuming all the groundwork's already done, the basics, which is, it's understating it, but it's a lot, right? To even get to that point of, being sufficient for you to qualify and to be a candidate for implants. But assuming that's all done, right? Once you book that specialist out, it might take 3 to 6 months, realistically. And I'm talking, not everywhere,
right,
but many places, 1 to 3 months is pretty standard. 3 to 6 months is, it happens quite a bit more often than you would think.
Right.
And that's a big headache, right? Because between that 1 to 3 months, a lot could happen. It's summertime now. Oh, we have a vacation plan.
Mm-hmm.
Somebody's having another kid, right? Elderly parents. Somebody is sick.
Right.
A million things could happen, right? Really, and it's just life, and we get that. Right? We absolutely get that, which is why we set up Elegant Implant the way that it is. For us, our motto is you book in days, not weeks or months, right? Literally in days.
Sure.
And then our staff helps you get through that. All the paperwork, all the testing requirements, all the x-rays, all the charts, these are perio charts or these are dental x-rays.
Mm-hmm.
We help you get all of that, right? And so that's the first big point, right? Which is the availability and then speed to procedure. We'll call it just speed to service, right? So it's a really, really big one, and I can't overstate it, right? So that's the first one. Second one is just the hours, right? Specialists available 7 days a week,
Mm-hmm.
completely unheard of. This is like kryptonite meets Mars meets, it's alien. It is completely alien, right, in this industry, right? And Matthew said it's a lifestyle sector, it's a lifestyle segment. Take your own pick, call it what you want, right? But banker hours, lifestyle segment, choice of practice, choice of service, we're here, all right? We are here. Call center is 24/7. And then the third one is, there's actually so many. So
there's a lot,
yeah, there's a lot of just firsts, right? And then the third big one I would say really is just we've gone over that, but the collection of brain power. Right, all of those specialists available at your fingertips, right? Because let's say you Dr. Ilya happens to be the one who reviews your case and who actually performs the service, well, guess what? He's not the only specialist that has looked at your charts. He's not the only specialist that will be discussing your treatment plan and your treatment procedures. Right? There's a lot of minute decisions in the meantime. Right? Something as simple as, okay, can we save that prosthetic? Can we save that denture? Or do we have to completely extract and take out that tooth? That is a point where specialists will contend upon. Reasonable minds can differ, and they often do.
Yeah.
So, that's something I take for granted, like the everyday person, we take for granted. It's like, well, that's what you're there for, right? And that's the thing, right? Having that much brain power all at the same time is crazy, all right? I tell you, that they fight, they disagree, they kind of sometimes draw their line in the sand and they stand their ground. But at the end of the day, the benefit is we, as the public, we, as the patients, we get the best care possible. And so far, in my mind, that hasn't yet happened. All right, so that's point number 3. Want to throw number 4 in there?
Well, I think kind of to elaborate a little bit more on that as well,
Yeah.
it's just the key to get to that point is to do something that is not normal in dental practice, and I call it the patient interview. So, providers and offices, on average, generally when you go to a practice, especially, you get a high volume practice, not a boutique or a specialty kind of a practice, you're going to get run through the mill. You're going to get told, okay, you're a patient number 119, okay, cool. Then you go into the back, you get seen. Okay, what is going on? They ask you, they're very methodical. Sometimes they're nice and friendly if they're new doctors. If they've been in the industry, just like dealing in medical, you get somebody so seasoned, they just start handing that thing out, knocking you out, getting it done and get out the door. So you don't really get that personal touch. And the whole time, and I've seen this, again, consulting with other practices, you're just sitting there, and you're just like this. You're just like, I'm here for a crown. Okay, well, you need this, you need that, you need this, and I recommend doing that. Okay, great, we'll see you next time. And then they bail out on you, go to the next chair, and you hear them buzzing around, drilling on someone's tooth, and you're going, I have questions, I don't know who to talk to. And then you talk to someone in the front, and they're like, well, you have to wait and schedule for Dr. so-and-so, and you just think about it and keep in touch with us. And they're trying to burn rubber, trying to keep those other patients going. So that's, oh my gosh, that's crazy.
It's pretty standard, though.
It is very standard.
That's what happens.
But it's unfortunate because when you're dealing with these types of procedures, it's life altering. You guys know this. You're dealing with teeth that are missing. You've had, bombed out infected teeth, or you've gotten to a point where you're financially able to take care of these things, and you're ready to go. You don't know where to go because the norm is to go into these factories, and that's not fun. So